Thanks for joining today. My name is Kath Burns, and I'm a licensed psychologist doctorate here in Vermont, and I wear three hats. One is I'm a practicing psychologist at a pediatric office here in Chittenden County that supports kids and families. And I work for Vermont Care Partners as the quality director. And most pertinent to this workshop today, as part of my work at Vermont Care Partners, I'm actually the clinical supervisor for this project. So some of you may have joined us before. We've been providing a bunch of workshops within AHS as well as all over Vermont, promoting wellness and recovery through this whole pandemic. And so I'm just very appreciative of your joining today. And you'll see it's a handout for today's discussion. I'm going to put it there again, that if you want to download that, it's a helpful, everything that we talk about today is referenced in this handout, and it might be helpful for you to take that back to your teams. And it also has a bunch of other resources you might find interesting. COVID Support VT is actually funded by FEMA. And what happens is when a state is declared a state of emergency, funds for a crisis counseling program become available. And this time is the first time ever that all states in the union have actually qualified for these funds. And all states, to the best of my knowledge, are funding these programs. So these funds come in and they're managed by Vermont's Departments of Emergency Management and Mental Health, and they're administered by Vermont Care Partners, as I mentioned before. And Vermont Care Partners is a network of 16 agencies around the state that support people who have mental health conditions, substance use disorders, and intellectual and developmental disabilities. And you might recognize one of the logos from the agencies in your community. The goal of our program really is to support individuals and communities with their well-being during this time. And we do that through a lot of different things like short-term supports, workshops like this, discussion groups, debriefing opportunities, pretty much whatever is helpful we try to do. And I'll talk more at the very end about how you can access other services and supports that we offer. And what we're going to do today is we're going to learn more about anxiety related to reconnecting. And I used to call it re-engaging because that's the word reentry, that's the word that's being used in the popular press. But some people were confusing that with our corrections work. So we're trying to shift that now to reconnecting. It means anxiety you might be experiencing with changing your life now that the pandemic is shifting. Maybe you're going back to a prior job. Maybe you're trying to figure out how to go back out in the social world. Whatever that is, that falls under the category of reconnecting. And we're going to talk more about that in a minute. We're going to process and debrief a little bit about your experience, and then we're going to discuss ways to cope, kind of intermingled throughout today's discussion. So, but first, I want to point out that it's really important as you go through your day, as you go through your week, and whatever role that you're in, to find a way to allow your mind to stop. And, you know, if you've been in a workshop with me before, and I'm guessing some of you have, you know that we typically start out with something. And one of my favorite ones lately has been to simply look beyond your screen, or if you're on a phone, I know a few of you are on a phone here today, to look outside your window and notice one thing that represents the word calm. So for an example, out my window, I have a bird feeder, and I love seeing birds, and it makes me feel better. And I'm guessing, as I asked you that question and you turned around to look out your window, that you weren't thinking about stress at that moment. At least I hope you weren't. Probably as you looked outside and noticed the leaves blowing, your stress level wasn't high. If anything, in that instant, it probably went down just a little bit. And little things like that, like if you were to set a timer on your watch to remind you to look up, you know, once an hour and do that activity of what represents the word calm, I can guarantee that your stress level will go down. And there's really good research that just minutes a day can reduce experiences of pain and stress that can have actually quite impressive health impacts, positive health impacts. So think about those types of things as we go through our discussion today. All right, so let's just get some definitional stuff out of the way here. And that is, what is reentry anxiety? And, you know, what we're finding is about 50% of Americans are feeling anxious about resuming this in-person contact, regardless of their vaccination status. And a lot of people are feeling really shocked by that. And as I've been asking this question, and my team's been asking this question, you know, how anxious are you about going back out in the world? You know, what we're finding just in our informal polls totally matches this. Half of people are feeling anxious, with people ranging from so anxious they're afraid to leave their house to anxious enough that it's giving them pause. And there's a lot of different reasons for that fall into two main categories. And one is, being worried that you're going to get sick, or being worried that someone who you care for is going to be sick. People 12 and up can be vaccinated, but people with young children are telling me, I'm nervous for my little kids because they're not getting vaccinated right away. Or I live with somebody, or I have a pre-existing medical condition that will continue to put me at risk despite being vaccinated. The other category is just how to do social interactions, and a lot of people have been out of practice. They feel clunky. They're worried about, how am I going to do this? And there's actually a lot of sort of funny things on television and in media where people talk about their clunky efforts of getting back out there and re-engaging socially with the world. And this is just a real common one. Quite frankly, if you have not been to a potluck in your neighborhood in 18 months, small talk, how do you do that? You don't even know what's been happening with people probably because you haven't seen them. So these are the main categories we're finding. And sometimes people experience both, and even at the same time. So it kind of makes sense, doesn't it, that people might be feeling worried. And we know that there's people who are more at risk for this type of anxiety. And as I just mentioned, people who have pre-existing conditions are absolutely more at risk. People who have suffered losses during COVID. And this is specifically about family and friends, but I would expand that definition of loss to other things, whether it's jobs, job definitions, traditions, patterns. Those are all things that can make you feel more stressed from COVID. People who have experienced severe financial distress or unemployment, poverty, food insecurity, and beyond. And then other groups that we know continue to be at risk are people who are essential workers and first responders. And in this category, we often, for very good reason, go to people who work in healthcare. But we are starting to underscore too here that we're talking about people who have had to go to work and be exposed during this whole pandemic, who really didn't have a choice. And sometimes those are the people who are working in more of the physical plant of some facilities, or people who are at gas stations who have less choice and less flexibility in their work. And then we also know, there's communities that have been really disproportionately affected by the pandemic, such as the BIPOC community and New Americans. So the first question I like to ask people, what kinds of things make you feel nervous about reentry? Okay, and you see an example there. I don't know who's been vaccinated, so I'm unsure about who I can be around. And I'm going to write, I don't remember how to make small talk. So what kinds of things have been making you feel anxious about going back out into the world? Maybe it's something about your job. Maybe it's something about your family. I haven't been out in the world since March of 2020, and I'm nervous about speaking with people. That is completely fair. And when I'm working with kids around that kind of stuff, we actually practice it. Someone else is saying I'm immunocompromised. And so the world for people who live with that are really, it's a real thing that they have to consider the safety of going out in the world, because the vaccinations, the data is telling us that the vaccinations may not be as effective as we had hoped. So we have changing to different locations from our team hasn't been in a while, okay? A lot of people's work lives are completely changing. And one of the things I'm going to do at the end is do a little bit of debriefing. And I'm hoping that you can read some of the things that are there today. I'm putting on my glasses so I can see them better. I'm still afraid because I have an underlying condition. And I've liked teleworking and I feel productive at home. I'm an introverted heart. And a lot of people are feeling that way, that they've really developed some habits, and we're going to talk about this more later, that have worked for them. So we have, my kids are too young to be vaccinated. That's coming up a bunch. What if I still want to wear a mask? Will I be looked at differently? I've never met my coworkers in person. I just met my team for this project in person for the first time yesterday. It was the strangest thing and a wonderful thing. I figured out how to manage my chronic illness at home, but don't know how to do the same in the office. Yep. Having to get dressed every day. I joke with some people, having to put on pants with a button is a whole new thing, but it's true. Getting dressed for going to work is a different type of experience. And if I'm uncomfortable, how do I leave a situation without hurting feelings? That's right. And remember how I started today's discussion by saying, I think we all are trying to use a lot of grace during this time. I think that's the case during this whole re-engagement period, where we start slow and we express and practice grace to each other. So if it feels uncomfortable, you can name, I'm just feeling uncomfortable, this feels clunky. And sometimes that's enough to dissipate that feeling of discomfort. And some people are still struggling with not being sure about wearing masks in places like stores, having to go back to the office, and I haven't eaten in a restaurant yet. Right. Okay. So I'm guessing that if you saw some of them that you could relate to, right? You're like, oh yeah, that's me. Oh, I can completely appreciate that. Well, the next question I have, and I'm going to switch to a different ideas board, is, what makes you excited about going back out in the world? So what makes you excited about going back out in the world? So I'm going to put an example here. I'm excited about a family visit. We're going to have a family party in my house for extended family that I haven't seen in a while, and we're all vaccinated. And I can't wait. I'm totally excited. And I'm curious for you all, what types of things are you excited about? I'm excited to see my family and watch my kids play with friends and cousins. Okay, I'm excited going on a 2-day local overnight trip. I know, going to the movies. Wow, that is going to be really fun, won't it? Excited for play dates for my children, excited to see my family, watching my kids play sports, but looking forward to when they don't have to wear masks to do so. And, oh, this is fun, that they are doing Christmas in July with her family. I think that is just fun. That's right, very exciting. Travel out of Vermont, traveling to Aruba. Okay, we're going with whoever that is. Take my family to fun places, not having to wear a mask anymore, planning a girls' trip. So, while we're trying to understand, managing anxiety is always a balance between recognizing where the anxiety comes from, but also balancing it with the benefit of what you get out of it by not giving into the anxiety. Does that make sense, I hope? So this little exercise of identifying what makes you scared, but what are you looking forward to, is designed to help you understand the types of things that can help fuel you to kind of make this reentry process, re-engagement process better. So there's lots of things to look forward to. All right, let's just really quickly talk a little bit about just the effects of stress on our brains. I think a lot of us know this intuitively, but it never hurts to go over it quickly. And we know that when stress is something that can be motivating, and it's very likely that levels of stress have helped us to be more compliant during this time of the pandemic. Stress over getting sick actually probably motivated us to wear masks and to practice social distancing. And for some of us, there's some people who still struggle with that, but stress is purposeful. It can help motivate us to get out of situations that are scary or dangerous, right? But the problem with being on perpetual stress, because you can see how the hormones associated with stress here in the middle can affect all other parts of your body. And some of you I know are experts on this, so I'm not going to spend a lot of time on this. But we know that when you're on high levels of stress for a prolonged period of time, you can have things happen like have high blood sugar, which can increase your risk of diabetes. You could have heart disease, high blood pressure. You could have a weakened immune system. You could have anxiety, depression, headaches. I know at the office where I work, we just have a ton of kids that have been referred for concerns out of, for stomach aches and headaches. And when you drill down, a lot of those really are associated with worries about getting sick and worries about the pandemic and just living during the pandemic. So we also know that our brain on stress totally operates differently, right? And again, you all know this. So when we're unstressed, we tend to operate more from the part of our brain that thinks, right? So from the front of our brain, the part of our brain that thinks logically, processes information in a way that helps you kind of go through steps of how to manage yourself better. When our brain is under stressed, it's actually working more from areas of the brain or lower parts of the brain where you're thinking less and responding more. All right. So talking about stress isn't just something that we make up to be fun. We can see how our brains operate when people are under stress versus not. And we know that if you're able to regulate your stress better, then you're just going to be operating from a place, even physiologically, that just will work better for you over time. So let's go through some tips, just some general tips about how to manage this whole reentry process. All right. First of all, this is my favorite. And for those of you who identified that I haven't done this, it's going to be clunky. How do I do it? Well, you start small. You start gradually. So don't make your first outing a rock and roll concert with all of your friends from high school. That would be incredibly stressful. Start gradually, maybe with one other friend, maybe outside taking a walk in a way that feels safe and comfortable, and be genuine about how you're feeling. Like, oh, this feels weird. It's exciting, but it feels weird. And it will come as you practice it and then build up from there. Fostering optimism is about remembering why it is you're doing it. So we just did that little exercise on ideas boards where you identified all these great reasons for getting back out into the world. That makes you just feel more optimistic and driven for doing it. You know, the reality is that while many people are still very much in the throes of managing COVID, a lot of people are starting to feel a little bit of optimism that maybe things are going to shift. You know, we're able to be out more without masks. A lot of the restrictions have been lifted. And it's important while you balance your anxiety to really look towards the things that make you feel more optimistic about what's happening for you and the world around you. Now, it's really funny because sometimes when I put this up, develop self-care and mindfulness routines, I can get a real knee-jerk reaction from people because you say mindfulness to people and they get frustrated, like, oh, I don't like yoga, or I'm not going to a yoga class. Well, self-care activities can be taking a break and watching TV. It could be listening to music while you cook, if that's something you enjoy. It could be digging dirt in the garden. It could be taking a 10-minute walk break away from your desk. It could be that simple activity that we did at the beginning today where you think of a word and you look around to find something that represents that word. Whatever it is for you. I also have tried to meditate and I'm terrible at it. And I've decided that that's just not something I really can do, but I do a lot of walking and just naming things that I see, and that helps my brain stop. Whatever it is for you, keeping that up through this process and beyond is really important. And it's also great modeling. A number of you have young children. It's also great modeling for the kids in your life because they're going to watch you, and you can even talk about what you're doing. You can say, oh man, I'm just feeling stressed out. So what I'm going to do is I'm going to go outside and watch the wind blow. Why don't you come with me? I know it'll make me feel better. And I even do that with my teenagers. They roll their eyes and then they come with me. It's very helpful. And if you're a person that actually is in charge of a group of people at work, I would encourage you to do that same modeling at work. It gives them permission to do the same, and it makes you feel better, and your team will come together more as a result of it. Another one is to make sure you have solid information about the pandemic, and about what's safe and not safe to do. And get it from reputable sources at a time of day when you're ready to hear it. Our world is a flood of information, and it's really important that you feel good and safe about the kind of information you get. So back to this, get good information. Our Vermont Department of Health has been amazing, I think, in terms of keeping us safe. And I think in terms of letting us know what we can and can't do. I am so very thankful to live in the state we live in, and I feel so much healthier and safer as a result. And the CDC, while I know they've been criticized for how they send information out, good information does come from them. So make sure you're getting your facts from good sources. A lot of people talk to us about, how do I set boundaries with people about this? How do I know who's been vaccinated? What if my kid's best friend's family doesn't believe in vaccination? Well, it's okay to say to people, to first ask, have you been vaccinated? Or to say, I've been vaccinated, how about you? So that you know where you stand, and then to make decisions that are good for yourself about that. If you're a person who's immunocompromised and you are likely going to be around people that have not been vaccinated, it is okay to say simply, oh, thank you for the invitation, but I'm not available. Or, no, thank you, I appreciate your thinking of me. And you don't even have to explain why. Or it's also okay to say, I'm really sorry, but we can't be together inside because I just need to be around people who are vaccinated. I think it is not how we would have communicated before the pandemic. But remember, as we emerge from these major events, part of the new normal is about developing patterns and ways of communicating and boundaries that work in this new circumstance. So it'll feel weird in the beginning, but it'll get better over time. And then we talk about this all the time, and I think it's so hard to do, but really limiting your social media. So just this morning on the various devices in my home, it's amazing how many alerts come up, and I had forgotten to turn them off. And I really encourage you to turn off all alerts on your phones and computers and choose when you want to digest information. because our brains process information even if we're not actively choosing to process information. So pick a time during the day, not before bedtime, not when you're tired, when you want to learn about things, and then actively go and look for the information that you need from reputable sources rather than having it come at you. All right. Now, I like to talk a lot about this notion of avoidance. And when I'm talking with kids, I talk about how anxiety is like a big old bully that loves to tell you what to do. And now you're all adults, so I really shouldn't put it in that way, but it's sort of the same thing. Anxiety is going to tell you not to do it. Anxiety is going to tell you to avoid it. And in fact, what we know is that to deal with anxiety, we have to slowly expose ourselves to the things that make us anxious and to not allow ourselves to be completely bossed around by this experience. So if you were to rate your anxiety about going back into the world from 0, I have none, to 10, I have so much anxiety, I'm panicking. What you want to do is create sort of a list. You know, if you're up on that scale in terms of your rating of anxiety, I'd really encourage you to sort of make a list of low to high exposure activities that you could start working on slowly. So maybe a low activity would be to go for a walk with a friend you trust. And then maybe the next one is a larger group, you know, whatever that is for you, to do it, use your strategies for self-care and calming, and then keep doing it. The more you practice it, the more you do it, and the more you expand how you re-engage, the easier it will get. And I know at some of your jobs that's trickier, but I think it's really important that you spend time with your employers to talk about what you're comfortable with. You know, and there's a lot of information that you can get to through our site and also through the handout that I shared earlier about just your rights, you know, your rights about safety and what to do and where to go if you need more support. I think most employers, the vast majority of employers, are doing everything that they can to support people to do well and to feel well. And it's important to talk about what your needs are. And then seek help. So if you're really struggling, if you're trying to do these things and you're finding that it's still really hard for you, reach out to your doctor, to mental health provider, to your EAP. We have some numbers at the end you can use, to a good friend, to a faith-based leader, whatever that is for you, to help you develop specific strategies for you to help you get back out there. Because again, the more you practice it and do it and couple it with calming techniques and reminding yourself that it will be okay in time, the easier it will get. All right. I've been finding that a little bit of debriefing is really important. You know, there's a step that occurs before you start marching out into the world that really makes it better, which is to spend a little bit of time just thinking about, what have I been through here? All right. What did I learn about myself that I liked? Like somebody wrote earlier, you know, I've kind of liked working at home. And then what do you want to keep in your life moving forward? So let's start with the first question, which is, what did you lose or have to give up as a result of the pandemic? My entire work life was flipped upside down. I no longer could see kids in person, you know, clinically. My children were no longer in school. So I'm going to throw those 3 out. What types of things did you all have to lose or give up as a result of this pandemic? Going to the gym. That's been huge for a lot of people, is giving up their routines. Travel. Thank you. Yes. A lot of people canceled trips, seeing family, not being able to see my adult children, rescheduling my wedding 3 times. Oh man, what other types of things did people have to give up? I know a lot of people were sick themselves or had losses in their families. Family reunions, absolutely. A consistent schedule. A lot of people's schedules went out the window and they had a really hard time functioning for a while, particularly with their sleep. Someone else, their husband and their son lost their jobs. And then singing. A lot of churches are struggling with the loss of singings, canceling a trip to see family in Ecuador, not being able to see my mother and brother and sports and the gym, and not being able to go to Florida in the fall. How many of you were your work was just turned upside down? My alone time, believe it or not. Yes, a lot of people, all of a sudden you were home with everybody. Church and spiritual events. Lost the time to be alone. Yep. Most of my work was face-to-face with large groups. Gone. I worked in an ER. We had to make separate COVID ER. I know I was diagnosed with an illness and wasn't able to see doctors or get in-person support. Yep. That was really frustrating. People couldn't get the care they wanted. And then we had the cyber attack on top of it. Virtual support's been amazing, but it's not the same. Homeschooling, that was tough. And a number of you I know probably homeschooled your kids while working and probably felt exhausted from it. And then someone said hugs. And a number of people in AHS became 100% COVID response, which is brutal. And some people are telling me that now the thought of demobilizing is hard because they feel like going back to their old job. It's sort of like they lost the perspective of the importance of their prior job. Not hugging the friend, didn't lose weight. A number of people have told me they gained weight, especially in the beginning, because they couldn't go out. Okay, we could talk about this a lot, and it's really important to spend time thinking about what did you lose? I think there's such a perspective that we have to be positive and look forward, and that is true. But I also think it's important to spend a moment and go, okay, what shifted in my life? Because if you don't do that, it'll make re-engagement and demobilization harder, all right? Because you're not recognizing what you've been through. So now the next question is, what are some things that you learned about yourself? Maybe something that you liked that changed in your schedule, or some capacity that you didn't know you had. Okay, so being able to take my dogs out 3 times a day. And someone else said, you know, I really liked being home. I like puzzles. I have one set up in my living room right now. I've taken a lot of simple things for granted, like toilet paper. A lot more yard work. You've been enjoying that? We're able to slow down, enjoy the outdoors, working from home. I love teleworking and I feel more productive. Yep. And think about what it is about these things that you like. I've not had to be on the run all the time. I'm hearing that a lot. I'm more of an introvert than I thought. I'm more present with my kids. You know, I have teenagers and I felt like I got my teenagers back. It was really cool. I love teleworking and having better work-life balance. Great. I spend more time with my 4-year-old, not commuting an hour and a half a day. Yeah, I got to ride my bike to my office in Richmond a lot more, which I loved. I learned that I can adjust. So in thinking about how you did this, how did you do that? So learning that you can adjust, having more time to be organized with the extra 2 hours a day that you're not traveling. I can do what I need to get better, including asking for accommodations. Yep. And I'm also still a strong and reliable person. That's right. I've been able to support my coworkers through single parenting, family health issues, and challenges. So you've learned you're a great support. You've learned you can ask for support. So when you think about it, I just want to point out to all of you, you've identified some things that you value. All right. And values are our guideposts for how we can, this is actually a restart that we have here coming at us when we think about going back out into the world. So in this brief little conversation, you've identified things you value: being with your kids. You value being able to adjust and figure out a new schedule for yourself. You value having time alone. You value independent work. All right. I'm just thinking of some of these things conceptually. You've learned that you value being to ask for accommodation as well as to offer support to others. And I hope I'm making sense. So as you reflect on that question about what did you learn about yourself, you're actually sort of identifying things that you might also value in yourself and in what you want. So when you think about that point, if you think about these things as sort of guideposts for yourself, what do you want to try to keep in your life, whether it's professional or personal, moving forward? You know, a concrete example I'll offer you is I do value time with my family, and we just had a conversation the other night that we will be keeping Frozen Pizza Friday in place from here on out because it's a time that we can connect. So what about you? What are some things that you want to try to keep in your life moving forward? Recognizing that may or may not be possible with your job. Family bike rides. That's wonderful. People just have had more family time. No commuting. Slowing down and staying flexible. Yes. What else? The ability to say no. And I'm going to get back to that in a minute. Not feeling obligated to do things that we really don't want to do. Working from home. Yep. Having a strong connection with my coworkers. Taking the time every week to check in. See, during this time, we've had to purposely reach out to the people we work with and say, how's it going? That made you feel better during this time, but it also, you learned that you like it, which is great. Reading for pleasure. Spending more time with my kids. Thinking of ways to be creative at work. Absolutely. So whatever these things are for you, I would encourage you not being on the road so much for work and being virtual. I think, first of all, I think that a lot of our jobs will probably be a combination of virtual and in person. So as you construct your life, all right, and as you work with your supervisor, or if you are a supervisor, think about these things. These things that you value, having conversations about how you can build those in. So if you've been able to really be incredibly productive working virtually, having a conversation with the people you work with about how to do that just makes sense. If you found that you appreciated virtual work because it made you more efficient, then that's a great thing to talk about. If you found that you really appreciated not having to commute as much, if it's possible to negotiate that, that would make sense. Spending time with your kids. I would say our culture is one that tends to be very, very busy and packed. And all of a sudden it wasn't, and you were just together. And if that's something you value, before you start putting a lot of ink on your family calendar or personal calendar, maybe pause and think, do we really want to do that? And then someone mentioned the ability to say no. And there's been a lot of interesting commentaries on public radio lately, and some of them have been really interesting and I've appreciated them. But one of them was about this whole idea that we've come from this incredibly social time. We were forced not to be social. And then now we get to choose how we want to do that. And one of the things one of the presenters said is, no, thank you is a complete sentence. And it's okay, before you go out and fill your schedule with tons of social things, it's okay to decide, do I really want to do that? And say no. Of course, you want to make sure that you're saying no because it's a choice, not because you're just scared. If you're just scared, then you want to think about, okay, why am I scared? Is that reasonable? But this really is an opportunity right now to sort of reconstruct how you want to live your life personally and professionally day by day. And I hope I'm not going on too long about this, but I just think I hope we never go through a pandemic again. And major events like this do offer an opportunity for how you want to be moving forward. I wanted to throw that out there. So maybe as we're wrapping up a little bit here, writing down on a sticky or something that you want to keep in your life moving forward so that you don't forget it, because it's easy to get swooped up into things. Okay. I'm wondering, what are some things that you do to ease your anxiety? Like the basic formula for me, and basic formula that we promote is exercising each day, whatever that is for you, mindfulness, making your brain stop, eating well, sleeping well, connecting with people often, doing things you enjoy, and spending time outside can really help. Consider writing it down and giving it a try. Some of the fun things people have shared with me are different apps they use, hiking. People have a lot of different ideas about things they can do to be active. It could be simple stretching. It could be playing a game. Breathing is a big one. And admitting I'm anxious, letting people around me know about it. Absolutely, because then they can help you. And I often tell people that if someone tells you they're anxious, listen to that and then cue a skill to help them cope. So bike riding, committing to and completing exercise. I drive with nowhere to go and listen to music. Crocheting, using Headspace. There's a lot of great apps out there. If you're an apps person, we have a lot of apps on our site that are helpful. Taking the kayak out, it sure does help that we live in a beautiful place where we can get out. Watching retro TV. Sometimes the answer is just chocolate, and that's great. So I think it's really important to build in something every single day that helps you ease your anxiety, even if you don't need it. All right. So if you practice doing something every day, when you are feeling more anxious, you're going to find that it's easier to do those things to feel better. Okay. So you don't have to be a marathoner or a mountain climber, to find ways to ease your anxiety. It could be simply sitting, looking out your window at something beautiful and just breathing. So just take a moment and write down some things that maybe you could try to ease your anxiety or build into your day for every day, and stick that on your computer. So you have two things, something for anxiety management and something that you want to keep in your life moving forward. All right. So a few numbers, you all have the Employee Assistance Program in the state of Vermont, which is an incredible resource. That's available, they have counseling and other things available to you. Our program just got extended. It was supposed to end June 15th, but FEMA just extended it to December 15th, which is very exciting. We have counselors who are available Monday through Friday. You can reach them by calling Vermont 211 and selecting option 2. And we are there. And if we're not there, you can leave a message. You can also go to our website. I'll put that up in a moment. You can refer a friend for us to call as long as they have permission. We're happy to do that. On the screen, you can see the number for Vermont Health Link. A lot of you probably have that. And it's a great place to call to get information about services for people with substance use concerns. And then the two numbers below, one's a text number and one's an 800 number. They're both available 24/7 if you have concerns about mental health, suicide crises. Please call, and you can call about somebody else. Now, someone wrote me and said, I don't want to get vaccinated. And there's a lot, some people have good reasons for that. Maybe they feel unsafe, they don't have enough information. Maybe they've been advised not to be vaccinated. And this person is saying they feel like they're an outcast. And how do I deal with that? And I think you deal with that by having confidence in your own decisions. I think you deal with that by taking care of yourself and wearing a mask as you need. And then also, you know, if people ask you, are you vaccinated? Just being truthful and saying, no, I'm not, but I'm following precautions. And I think there's also just the anxiety about feeling like an outcast. I think a number of people share that feeling, particularly with having to wear masks. And there's a lot of people who are going to have to continue to wear them who have health conditions who are concerned about the same thing. And I think part of it is also talking about that and using your strategies to manage your anxiety, but that is hard. I'm not saying any of this is easy, by the way, everybody. Quite the contrary. I think this is probably the most challenging time that we will all have lived through in our lives. And I think by asking for support from others, talking about it, really developing a plan for supporting your own wellness really does make a huge difference. All right, what you see on your screen here is our website. Please visit it. The other thing you see on your screen is our email, our general information number, or you could call us. We're always happy to be helpful. Please, 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 please reach out. We have one of our counselors is starting to help me coordinate all these workshops, which is great. And we're happy to do just about anything we can to help people out. And then finally, the last link is to a handout about information regarding this workshop. And it actually has links to a variety of other places. So I would encourage you to download those and have them and maybe look at them later on. I just really wish you all best of luck moving forward. Here's a good question. How to maintain closeness when you have less time to spend with someone? Well, that's true. We've had this intense period of time. All of a sudden, we're going to have less time together. And I guess what it means is the time we have together, we have to make it more quality time. So if just because of time constraints and having to go back to the office, you don't have as much time with your family, then maybe what you do is go for having some planned periods of time when you're together and you don't have other things going on. Like you put down your phones, you do something you enjoy together. So that is quality time. Sometimes it's not the time, it's the quality. And I think a lot of people are grieving the loss of that close feeling. It will shift and change, and you all identified that you're pretty resilient people. Thank you so much for joining today. And please download the handout and just best of luck to you. All right. We really appreciate your time and spending time with me today. And please let us know whatever else we can do that could support you during this time. Okay. Have a great day. Stare out your window and fill out your stickies.